The purpose of this video is to give you, the patient, information and instructions that you will need to care for your surgical drain or to help your loved one care for their drain after surgery. Your surgeon has chosen to leave a drain to aid in your healing. A drain is a closed system that works to pull fluid away from the surgery site. It goes underneath your skin and has small holes at the surgery site to draw fluid away to prevent fluid from accumulating at the surgical site. It works by having the bulb compressed and capped to create gentle suction. It is important to secure the drain with a pin to any clothing or to a surgical wrap such as an ACE wrap or to a lanyard to ensure that it is not hanging freely, which could then cause accidental removal. And this having it pinning will also prevent discomfort at the drain insertion site. The drain is held in place to the skin with a stitch. You may also have a clear dressing over where the drain comes through the skin. This is meant to leave in place until your provider removes it. If you have gauze and tape over the drain exit site, you will be changing that daily or as needed. We will show you more about this later in the video. The drainage may become lighter in color over time. This change in color is okay. It may start out looking very bloody or dark and then will slowly lighten up until it looks more straw colored. The amount of fluid draining from the drain may also change. At first, the drain bulb may fill up several times a day, requiring you to empty it more frequently. Then over time, it won't drain as much, so you may only need to empty it once a day. I will now be talking about how to care for your drain. It is important to wash your hands. This isn't necessarily a sterile procedure, but rather we want to make sure that your hands are clean. You may also wear gloves if that makes you feel more comfortable. It's important to have all of your supplies ready prior to caring for your drain or prior to showering. First, we're going to cover stripping the drain. We refer to stripping the drain or milking the drain as pinching and moving the fingers along the drain to keep it free of clots or debris. This is important to perform at least 3 times a day early on to keep the drain functioning properly and not allowing any debris to clog it. The way you start this is by pinching next to where the drain exits the skin and sliding your fingers down the tubing. Now, this may be a little bit easier if you have some hand sanitizer on your hands. This will make it easier to slide your hands over the tubing. Continue to pinch and slide your hands along the tubing until you reach the drainage bulb. You again want to repeat this several times each time you are caring for or milking the drain. Next, we will show you emptying the drain. It may be helpful to have an old towel or paper towel handy, something absorbent underneath where you are working to prevent the contents from accidentally spilling or dripping. To start, you're going to undo the safety pin or any way that you have it secured to the clothing. You're going to next undo or release the cap to let the drain expand. Next, you're going to take an empty specimen cup, which should be provided for you in the hospital. Carefully take the drain and pour the contents into the medicine cup or the specimen cup. It's important to measure and to log the amount either in cc's or in milliliters, in addition to recording the color. You may then pour this drainage down the toilet or into a drain to dispose. Your surgeon will want to know how much is coming out of the drain at each of your follow-up visits to make sure that the drain is removed at the appropriate time. When you are done emptying the drain, you want to make sure to gently squeeze it to recreate that gentle suction. Then take the safety pin and secure it either to your clothing like this, or you could also put it to a lanyard that may be provided for you also. You could also pin it to any dressings or ACE wrap that you may have around the wound, or I have seen patients tuck this into a pocket at the side of the pants or into clothing. But just be mindful as you're changing clothing or using the restroom, again, to prevent accidental removal. To talk about showering, it is important to, again, remove any dressings and then secure the drain into the lanyard here to prevent accidental removal. Any gauze dressings can be removed prior to going into the shower. Showers are very helpful, and an important part of healing after surgery is they can relax sore muscles, keep your surgery site clean. Unless told otherwise, you may shower 24 hours after your surgery. Do not scrub the incision site or the drain exit site, but let the water run over these areas. They may be tender, but allowing the soapy water to run over the area in an indirect manner may be helpful to minimize any tenderness at the site. Your drain is held in place by a small stitch that is placed at the time of surgery. This stitch will be removed once the drain is ready to come out. In order to change the dressing, you can use either whole 4x4 gauze or gauze with a little slit in it called a drain sponge. Both of these could be provided for you at the hospital or can be found at your local drugstore. With a drain sponge, in order to dress the drain, you can slide the drain sponge underneath the tubing to secure, and then you could take a 4x4 or an extra drain sponge and put in half to cover as well. Then you can take tape strips to secure it to the skin. If you don't have any drain sponges, that is okay too. Take the whole 4x4s and make a little bit of a sandwich by folding one of the 4x4s in half, sliding it underneath, taking another 4x4, folding it in half, or stacking a few on top like this, and again secure with the tape. And then repin the tubing to your gown or your clothes to keep the drain secure and prevent accidental removal. Now, the drain may also be dressed with clear dressing. As you can see here, there may be a little circular patch around it to support the drain and help keep the drain site clear. You will not need to redress or cover this type of a dressing, but leave the clear dressing in place as long as the drain is in place. You may shower with this type of a dressing in place as well. Next, we're going to talk about some common issues with drains and how to problem solve them at home. You are always welcome to call your office to speak with one of the providers if you have any concerns that these videos don't address. If your drain dressing becomes saturated and there appears to be drainage coming from around the drain rather than through the drain, you can start by stripping or milking the drain to ensure that the drain is working properly, encouraging the fluid to go through the tubing rather than around the tubing. You may need to do this several times, maybe even in a couple of different positions or with gentle pressure from around the skin in order to encourage the drain to start functioning again. You can then redress the drain and place additional 4x4s over the drain in order to absorb any drainage. Sometimes the drains just leak around the tube because it goes against the path of least resistance, which is the hole through the skin as opposed to the tubing. If you have had a breast procedure and have drains left in place, it is very important to ensure the drain is functioning properly, especially earlier on. If a drain suddenly stops working the first few days after a mastectomy, ensure the bulb is compressed and strip it several times. Examine the chest wall to ensure that there's no collection of fluid under the skin, suggesting a potential for blood underneath the skin, such as a hematoma. This may need more urgent evaluation in the clinic to be addressed. You may find that having a compression dressing over the area is helpful to gently compress. This is often placed immediately after surgery, so ensure that this is adequately tight, but not too tight where you can't breathe deeply. If the drain stops working, as in it's not holding any suction, please contact your provider through their office in order to speak with them and to be seen on a more urgent matter. Next, I want to give a few words to the removal of a drain. Your drain will be removed in clinic at your surgeon's discretion after your care team examines you, looks at the record of outputs that you bring with you. Thus, it's important to keep this log and bring with you to your clinic appointment. You may want to take some pain medication about an hour or 30 minutes prior to your clinic appointment to help alleviate any tenderness or discomfort around the site of removal. Your provider will remove any dressings and cut the stitch and gently slide the tubing out. Most patients report feeling some superficial soreness, irritation, along with maybe some discomfort deeper under the skin as the drain is coming out. However, most patients say that discomfort has greatly improved before they leave the clinic. You may then have a small opening where the drain was that may have drainage coming out. So you will need to change that dressing over that hole for the first several days until it scabs over. You may shower after your drain removal, but do not submerge the wound until the scab has fallen off.